particular focused on community mental health. There are three really important parts of this initiative. The first is the single front door. One of the things that I hear consistently as the Minister for Mental Health is how difficult it is to navigate the system. People don't know where to go if they're not feeling okay or one of their loved ones is struggling. The single front door is an entryway into the system to help them navigate where they can best meet support. And that service navigation piece is really important, and it's fantastic that we're putting $39 million into providing that pathway into support. The second really important thing we are doing is the pathways to community living. We know that for people with complex, chronic, long-term mental illness, living independently in the community is really tough. And when we ask them and expect them to do that without support, it fails. Their tenancies fail, they end up in our hospital, they end up in our prisons. This is specific money to invest in supported living for people with long-term mental illness so that they're able to live in the community, but that they have the support they need to sustain that housing. And that investment is going to be really important, yes, in saving money in the long run, but also in providing those people the kind of stability and safety that they need to live fulfilling lives. The third really important initiative that we're announcing today is an expansion of community mental health outreach. I think when people see homeless people rough sleeping, they recognise that for a lot of those people, mental illness is a really big contributing factor to why they're really struggling with their life right now. And people don't always realise that the teams that are going out to those homeless people are largely social workers. They're doing wonderful jobs as caseworkers, but they're not mental health clinicians. We're spending $30 million to make sure that mental health staff are embedded in those teams. We already send teams out to engage with our homeless community, and those teams will now have mental health clinicians standing alongside social workers, so that yes, we're talking to people about their housing needs, but we're also connecting them into mental health services. One of the things that I hear a lot is that if you're struggling with a long-term chronic complex mental illness, maybe you're not realising how difficult you're finding it. Maybe you're not reaching out for help. If you're a homeless person, you're not likely to be going and seeing your GP. You're at that point in your life really just struggling day to day. We need to go to them. We need to reach out and meet them where they're at to provide mental health support. And that is exactly what these mental health housing liaison clinicians are going to be doing. So I think this is a really important step to fill what are obvious gaps in our systems. Yes, there's more to do, but this is leaning into some of the most significant problems that we've seen, and I think it's really going to help people who've struggled to navigate the system, struggle to access the support services that they need, and wrap around them the mental health and housing support to keep them settled, safe and stable in our community.